Hello, everyone. I'd like to welcome Tina Lardner, who's speaking with me today. She works with Dr. Jim Harris in Denver, Colorado in the USA. So, Tina, I just want to ask you, how did you get into being a surgical assistant, and how long ago was that?
Hi, Nilofer. Thanks for having me. I've been a surgical assistant for about 24 years. I have an MA certification, so it was one of those things that I just happened to come across and thought it was the coolest thing ever.
Yeah, great. So you're a member of the ISHRS as a surgical assistant. So when did you join the ISHRS and why?
I think my very first meeting was in 2001. It was right after 9/11, and went to the meeting in Puerto Vallarta, and I thought these were the coolest people I've ever met. Got a lot of information and really clicked with everyone. So that was kind of the draw every year.
Yeah. So you've kind of been doing this nearly as long as I have, actually. So quite a long time. And I think during that time, you've been involved in quite a few different things within the ISHRS. What sort of things actually have you done as a surgical assistant?
It's kind of evolved over the years. I've kind of started off just kind of helping out with the meetings and doing presentations. There's opportunities to work in the background, so getting involved with the tissue prep team or getting things ready for the meetings. I really enjoy teaching, so been doing a lot of workshops and getting involved that way.
Sure. So I think the assistants actually have over the years been a very big part of the doctor's courses as well, especially the basics course. So can you just describe what happens in the basics course? I know there's a didactic session, but then there's a hands-on bit. So tell us a little bit about that.
Yeah, so the basics course is an opportunity for physicians to hone their skills in hair restoration, get them familiar with different parts of the procedure. And, there's, hands-on training, there's a lot of didactic work as well. The surgical census just kind of helps get that set up and helps the doctors along with that type of workshop.
Great. And you work for a doctor who's actually at the forefront of innovations. And, I'm sure that makes you and your team quite excited as well, because, it's not just the same thing day in, day out. So I know Dr. Harris was involved with the robotics and with his own FUE motorized device. So how do you feel that? How does that make you feel as an an assistant and as the lead in the practice? How does that make you feel?
It's great. It's really nice knowing that our doctor is super involved in the latest technology and is involved in the teaching part of it. That's kind of where I got my start as well. Just, his enthusiasm for the field and getting involved.
So, there's a lot at the moment in the media, on the internet, about clinics that we term as black market clinics, because they're using people who are not licensed to do surgical parts of the procedure. And one thing that concerns me in those sort of situations is that the kind of innovation that that you've seen with Dr. Harris would not happen, because if it's the doctor and the doctor's trying to improve on the outcomes, the surgical outcomes, then it's a doctor who's always thinking about, well, how can it be better? How can I get better grafts? How can I, develop new holding solutions, et cetera, et cetera. So, I believe, in your ethos, that is actually how things work in your practice. Is that correct?
Absolutely. We, do whatever we can to get the best outcome, and whether it's the latest technique or the latest holding solutions, we're going to do whatever we can to get the best outcome.
Yeah, that's great. So there's an upcoming surgical assistants meeting. There's always one with the annual World Congress, but there's other meetings throughout the year that I know assistants like yourself get involved with the teaching. So the talk that you're going to be giving at the upcoming meeting, I know you're the first talk on the program, so that's very prestigious. So what are you going to be talking about?
So I have a couple of talks. The first one is the no shave technique. It's kind of a technique that's kind of coming around, and it's great because, if the patient wants to do an FE procedure, they don't have to shave the donor area. We can just go in between long hair and trim individual hairs, and the doctor will find those trimmed hairs, and it looks like nothing was ever done. So I'm pretty excited about that technique and sharing it.
So do you bring the patient in the day before to do that, or do you do it on the day of surgery?
It depends on the size of the case. So typically, if it's over 1,500 grafts, we'll bring them in the day before. If it's under that, then we'll do it the day of.
Yeah, and how long does it typically take? So if you were doing 1,500 grafts, how long would it take to prepare the patient's scalp?
That's a good question. It takes about an hour to do the trim. In the beginning, when we were first learning, it obviously took longer, but we are definitely faster now.
Yeah. So what's your other talk that you're going to be giving at the
this is the one I'm probably the most passionate about, is training technicians and the method for doing that, and when to go live on a surgery. So I'll be going into detail about that and describe each phase of the training.
Yeah, great. So if you get somebody new who comes to you to train as a technician, how long would you say that it typically would take you to train that person?
I typically train in phases. I usually start with some of the easier skills first, just to get them acquainted with the procedure. And those are usually, graft inspection under the microscope or loading implanters. And then as they become more comfortable, I'll add other skills that are a little more technically challenged and get them up to speed. But, for those basic skills, it, takes a day or two to learn those skills fairly easily. And then that way we can move on to another skill.
And do you think it also would depend on the person's background? If they come from a medical background, they're already versed in infection control, etc. Whereas maybe if they don't, then that kind of learning all that kind of background stuff, I assume, takes longer.
It takes more time, yeah. And those are things that can be learned, but it does take a little bit longer to teach those.
Yeah. So another thing that I wanted to ask you about is, I know Dr. Harris was the first person in the world who did a study during COVID to find out about aerosols and whether we would be concerned about that, which is great, because that's something that we were really, really concerned about. So now that kind of things are starting to stabilize with people being vaccinated, have you dispensed with a lot of your COVID protocols, or are you going to keep those things in place for the foreseeable future?
Yeah, so after the vaccinations occurred, we kind of, eased up a little bit on those protocols, but now with the new variant out there, we're starting to go back to those tighter protocols.
Yeah. I mean, one thing we've found is that since we started all those protocols, that none of our staff got the usual, coughs and colds in the winter. Everybody was healthy all the time.
Yeah,
They're like, oh, wow, this works.
exactly. I
We're
know.
not spreading, stuff to each other.
Yeah.
Yeah. So, I think all of these things have taught us quite a lot. And we'll just have to see where things head in the future. So kind of the final thing that I wanted to discuss with you today was that for people who are new doctors who are new to the ISHRS, what would you say to them about the need for their assistance to actually join and to come to meetings? What's the value? Because I know a lot of doctors would be hesitant, maybe because of cost, but maybe because they think, another doctor might try and take their technician off of them. But in my view, that if I have got someone who is loyal and who I've kind of introduced to the subject appropriately, they're not going to actually do that. But, new doctors, why should they bring their assistants to the meetings?
Well, the whole procedure of hair restoration is a team effort, and you kind of need to get your team on board. And if they're learning new techniques and new protocols, it's good to have your surgical assistants involved in that process and knowing why they're changing those protocols. It's important for the whole team.
Yeah. And another thing, I mean, as doctors, we always kind of pick up tips just chatting with each other in the corridors, and I'm sure it's the same for assistants.
Absolutely. I probably learned the most from those conversations with other technicians. The lectures are great, but it's good to have that interaction because you can talk one-on-one with people and find out what they're doing and, if they're using a special tool or instrument. Yeah, so it's helpful to get that interaction with other assistants.
Yeah. And I feel that like each year is different from the year before. That, you pick up these tips, but you also maybe go to the exhibitors and you see, well, someone's got a new tool they've developed and maybe that's worth trying, or, just something kind of comes up, or something that's available for post-op care, for example. And that's the kind of place where I would say to my assistants, if they come, I say, right, you need to go around all the exhibitors, look at the stuff we already have, see if they've got, anything new, anything different. And they find that interesting as well. And like I know this year we've got two of our assistants who have never presented before, and they got really into it. They got really excited, and they did the research, they did the PowerPoint presentation, and I think they did a really good job. And they really, really enjoyed getting involved that way. So I think it's beneficial all around. It's beneficial for the technician, it's beneficial for the doctors, it's great for your education, and it's great motivation for people. And I think actually you're going to have a motivational speaker at your assistants meeting as well.
That's right.
And I think the other thing, and I know the person giving the talk is going to talk about this being a career rather than a job. And for some people, maybe it is a job. It's a way of just earning money. But for other people, if they really are keen to advance, to learn more, to write, you've written articles, for example, in the Hair Transplant Forum Journal. If people really want to do that and kind of advance their own kind of themselves, then all of those things are certainly available.
So absolutely, there's other ways of getting involved. You don't have to do a presentation. You don't have to be in front of people to get involved. There's other behind the scenes things that you can do, and I really enjoy writing as well. So I mean, that's something that people can do.
I think now as well that we've moved on to things like Zoom presentations. I think that gives people a little bit more comfort because they're sitting in their own home or their own office, and they can do voiceovers for their talks and take the time and just kind of keep doing it until they get it right. So I think I'm hoping that will encourage more people or newer people, different people, to actually step up and do that, because it's a more comfortable thing. Because I think it is very intimidating to kind of get up in front of people and speak to an audience, especially if you don't know most of them.
Exactly. That was probably my biggest obstacle in doing my first presentation. But, the more you do it, the easier it gets, and it's a lot easier.
Yeah, no, I agree. So I'd like to thank you for joining me today, because I think that was a really interesting conversation, and we know each other for many years, and we can just keep on talking, and
Exactly.
But thank you so much for the interview today.
Thank you, Nilofer. Thanks for inviting me, and it was a pleasure.
All right.